Welcome to Breakfast with Spaniels with Dr. Judy Morgan. Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Good morning. I don't know why our internet was so screwy yesterday, but it just was not having any parts of doing what we wanted it to do until about halfway through the day. So bad. We didn't even have bad weather. I don't know. It was the cosmic chi was out of whack. Anyway, I got an email that just kind of made my blood boil. And I feel really bad for these pet owners. And we all make mistakes in life, but when you have doctor in front of your name, you're supposed to be thinking all the time. And you're supposed to be your patient's advocate and do what's best for the patient. And so here we go. Hi, Dr. Judy. This is a question about my son's dog. She's a 12-year Beagle mix. She's been sick, not eating or drinking, throwing up, and pottying in the house. And that's how they knew something was wrong. Now, this is a 12-year-old dog. And in my mind, I immediately went to what I think the problem is. And what's interesting is as I got a little further along, my thoughts were verified. So they'd gone to their vet who told them she's basically healthy, ? And gave them something for her tummy issues. Now, I'm thinking we probably got some Serenia and some metronidazole would probably be the norm. I suggested chicken and rice and pumpkin, and she ate that okay for a couple of days, then back to vomiting and diarrhea. The last few days, she doesn't even hardly move or eat or drink. They took her back to the vet, and the vet said her spleen and liver were swollen, but that's normal for an older dog. Really? The person said, really. I also said, really? That's not normal. It's not normal. Our dogs don't have swollen spleens and livers. They're old. Well, some of them. No. Long story short, they finally decided they should, the vet decided they should do some lab work on this dog. They did some tests, and she's in kidney failure, which is where my mind went on the very first sentence. We did 12-year-old dog with vomiting and diarrhea and pottying around the house. I'm thinking she probably was drinking and urinating a little excessively. But the vet told them she's in kidney failure. Treatment at this point would probably do no good. No treatment options. The prognosis is grave, but we could try this, or this. Nope. No treatments. Just take her home. My blood was boiling at this point. And then this person says, first of all, I don't trust this vet at all. Well, it's not her dog and it's not her vet. But I would go get another opinion. So telling them there's no hope, I really don't buy. That's what she said. What would you suggest? What to do? Where to start for this poor girl? They said she has not hardly moved for almost 20 hours, not eating or drinking or willing to potty. Is it too late to help her? I'm really concerned because, and I don't have the lab values on this dog. I don't know how bad they are. But if her kidneys have completely stopped working, that's when they stop peeing completely. And I wrote back and I said, well, I don't know the levels on this dog and I haven't seen the dog. This is certainly a grim scenario that you're painting. If they want to do anything at all, I would certainly recommend going somewhere else and getting this dog hospitalized on IV fluids. And frankly, there are places that can even do kidney dialysis. So it just depends how much kidney function is left. But we've got no diagnostics on this. Where's the abdominal ultrasound to tell me what the kidneys look like? To tell me if, maybe there's an infection in the kidneys. There could be so many things that could have caused this, but we've got nothing. Now, I don't know whether the veterinarian thought, well, they don't want to spend money. It's not my place to judge whether you want to spend money. It is the veterinarian's place to offer you all options. It is the veterinarian's place to say, wow, your dog is really sick. I think we should get some blood work and try to figure out why your dog has started doing this. We need to figure out what's going on. This is an older dog. This is a 12-year-old dog. So let's see. Could we have a cancer? Could we have an overwhelming infection? We don't know. We've got to do some diagnostics. And then to offer no hope, no options. If the dog was that bad that the veterinarian thought it was suffering, then he probably should have recommended, and I say he, could have been a she, should have recommended euthanasia if the dog was suffering. But to say, oh, just take him home, there's no hope, there's nothing you can do, wait for him to die, I don't think that's the right option. Well, I don't think that's the only option. I can't say it's not the right option because I don't know. But I can say that there are many options in every scenario. So I have a client, good client, whose dog was just diagnosed with lymphoma of the tongue. Never heard of that in 36 years of practice. But right after I sent her to the specialty center because he had this weird thing on his tongue, and it got better with the antibiotics, and then it got worse again when the antibiotics stopped. And I said, and she kept sending me pictures, and I said, no, today, go into emergency if you have to. Let's get in and see somebody about this today. And she did, and they did a cytology on it, and it's lymphoma in the tongue. They've never seen it either. The specialists have never seen it. Very weird. But instead of saying to her, oh, there's nothing you can do, they laid out options. This is obviously a rough diagnosis, but they laid out options. And then she was on the phone to me she was driving home on the phone to me saying, okay, these are the things they gave me options to do. And I opted for this. Help me get through this. And I want him to have as high a quality of life as he can for as long as possible. So, there's always options. There's always options. And maybe euthanasia is the best option, but at least have a conversation about what is there. What is there? So this made my blood boil that the dog kept getting sicker and sicker because no diagnostics were done at the beginning. And if they had done the diagnostics, I don't know what the time period was, but it looks like there was probably a week in between the two visits. And in that week, if we started aggressive therapy earlier, we may have had a better chance in the long run. So she did email, and I emailed back and said that I was really sorry that this happened, and that it kind of made me mad, and I felt sorry for the dog and the owners that no options were given. And she said, well, they had decided they were going to go ahead and put her down and give her a really good last day, but she had kind of rallied and she was up moving again. So I don't know what the outcome is, but you have to push, guys. You when you take your sick dog in, you have to push, and particularly if it's an older dog, ask for the lab work, ask for it, and if they say, "Nah, we don't think you need it," insist on it. Teresa Carpenter says, it's so hard to step back and let my kids make decisions on their pets. They consider me a Dr. Judy fanatic, which of course I am, and make no apologies for it. Yeah, just had to do fluids for kidney. Fluids make a huge difference in the life. I mean, ask Michelle Allen at Monkey's house. She's got fluids hanging on every curtain rod, every doorway in her house. Dogs are getting fluids all the time. Fluids are an amazing thing. Amazing thing. So, all right, everybody have a wonderful day. We have one of those crazy every day crazy. Oh, I didn't even tell my story about Tuesday's craziness. Maybe I'll tell about that tomorrow. I had to have a special martini Tuesday night because it was so bad. Deb, she took her to Hope. Took him to Hope over in Melbourne. I like Hope a lot. It's kind of my go-to. I know it's a hike for us, but she actually lives closer out that way, so it was good for her. Deb, don't be. You got Dr. Candle and Dr. Bowling. Dr. Candle is becoming a pretty good clone, and actually Dr. Bowling is working pretty hard on that too, so. The specialty hospital that my client went to was Hope over in Melbourne. I like them a lot. I'm in charge.